Hello, everybody. Thanks for coming back. Hope everybody had a chance to meet with our partners during the break and was able to navigate here without any issues. So, this next session that we're going to have is environmental scanning during the COVID-19 pandemic. And real quickly, what I want to do is frame up this conversation that we're about to have and encourage you guys to all participate by putting information into the chat. So a little bit about this session. 2 years ago, NOSORH launched the SORH Core Proficiencies as a peer-driven method of identifying areas of capacity building for SORH. In our first 2-year benchmarking report, we found that many SORH identified a need to build their capacity in environmental scanning of rural community needs. So the Educational Strategy Committee reviewed the results and brainstormed how to build a session at this annual meeting that would help SORH to build that capacity, particularly in a situation that is relevant to all of us today. This session was the result of that great brainstorming, right? Focusing on environmental scanning as a skill, but through the context of this pandemic. The intent of the Educational Strategy Committee is that the tips, tricks, and tools that we're going to ask you to share in the chat box with us is that we'll compile a quick reference guide for you to keep at the ready going forward. So what we've tried to do is bring 3 very different perspectives, right, from your peers. So today we have with us Kirby Lisi from the Massachusetts State Office of Rural Health, Lisa Davis from the Pennsylvania office, and it's Sarah Anderson from the Oregon Office of Rural Health. So they're each going to share with us the very different ways that they've approached environmental scanning during the pandemic and how they use that information that they collected to make meaningful progress in their state. So with that, I'd like to welcome you and join me in welcoming Kirby, Lisa, and Sarah.
All right, so I think I am up first to kind of start us off and frame out this session. First off, I just want to say hello to everybody, and it's been so good just to see you guys chatting in the chat box and all these colleagues. It just reminds me of how much this meeting always fills me up and really helps me find my why, as we explored a little bit earlier today. So I'm going to jump right into getting us started in this session around COVID-19 and environmental scanning. So I'm here today because I am on the Educational Strategies Committee, and I'm going to talk us through today's agenda and kind of give you a little overview of what we're going to talk about. So a quick overview of some environmental scanning. Not only am I going to talk about this, but my other colleagues are going to talk about some of the work that they're doing and some of the overviews from their offices. We're going to talk a little bit about best practices for environmental scanning, and then talk a little bit about some of the examples from SORH. But most importantly today, and things that I want you to be thinking about, and I'm sure you will be, as I saw you all actively chatting in the last session, is to really share some of your examples and best practices. Chris is going to be keeping tabs on this and putting together a document that we're going to share at the end of our session today as we do some Q&A and some further kind of calling out of some of these examples so that we can talk about the great work that you've been doing and capture that as well. So what is environmental scanning? It's a really, I think, fancy way of just talking about the process that we use as organizations to monitor internal and external environments. So for us here in the State Offices of Rural Health, that's how we assess our needs, monitor activities, and really just understand the pulse of what's happening in our rural communities. But I also want us to think for a second about how this can also be an internal practice for us, like using the proficiencies that NOSORH has started for us, and how much I've heard from so many of you about how that process has been really great as an office to kind of go through and check where your strengths and and where your areas of maybe needing to work on some things or understand processes better. It's just a core component to our work. And I think what we really the big takeaway from today is that environmental scanning is something that we do every day as part of our work. And we really just want to frame that up and think about the best tips and tools and tricks and ways that we do that. And so, I'm here to say too that environmental scanning doesn't have to be fancy. At the end of the day, it's really about getting the results that you need to do the work that you're doing in your office. And so there are lots of inputs and outputs that factor on what type of environmental scanning we do. How many areas you're able to tap into with the staff resources that you have, with whatever types of tools you have at your ready, what kind of data you have available to you. And so really it's about thinking in terms of what's going to work for you to get the information that you need and the results that you need to move forward in your work. So, as I said, we're going to be talking about best practices today, but really we want to hear about your best practices. So if you have a piece of paper near you at your desk right now, jot down a couple of these. And you can even start now as we're talking through some of our examples, sharing in the chat the different areas that you are doing work in and that fit into these bubbles. So where are you collecting data and information? How do you analyze your information? How do you share that information? Who do you share it with? Are there tools that you're using, cool tips that you have? Start chat boxing that stuff so that we can start to take a look at it. And this slide is going to pop up at the end of our session again for us to be able to dig a little bit deeper into the great work that you're all doing. So as I said, environmental scanning does not have to be fancy, and there is a number of different ways that we can do this. And today what we've kind of decided to do is to work our way across the continuum a little bit today, with being more low resource and kind of quick action, all the way up to things that are a little bit more high resource and high input. And so you can see here our three presenters today is myself, Lisa in the Pennsylvania SORH, and then Sarah in the Oregon SORH, who are on here. But we also have some great examples that some of our educational strategies folks shared with us around some of the work that they've been doing. So in the Colorado SORH, one thing that they shared with us on the call was around some of these joint hospital calls that they've been doing. I'm sure everybody knows that during the pandemic, it's been like a fire hose of information that's been coming in. And so a lot of our hospitals and other stakeholders have had a hard time in kind of navigating this. And so the Colorado SORH really stepped in to connect all of those pieces and put all that information in one place in a call to their hospitals. But that also provides a nice streamlined place to be able to receive information back as well. A couple of other examples that I thought were really neat and interesting that some of our partners are doing is not COVID related, but I think still just as pertinent and important. So I want to make sure that everyone's thinking about things outside of COVID today as well for your environmental scanning and the things that we're constantly doing. And so our colleagues in the SORH in Oklahoma, they use the Robert Wood Johnson data that comes in to really take that and make secondary maps and information to look at regional trends to inform their work and also share that out in a report to their stakeholders and partners. Similarly, in the Montana SORH, they look at their community health needs assessment data and create this really cool map that has the different needs that are identified in those community health needs assessments in this kind of nice dashboard that then connects people to resources for collaboration and innovation. So those are just some great ideas. I'm sure that you all have a bunch of them as well. And so again, I'm just reminding folks to think about those and start sharing them in the chat as well. My example is really going to start us off in this kind of very small, low resource, low input from our office around how with COVID-19, we were able to kind of quickly pull together established communication channels. So because we do so much work, and I think the one theme that you are going to hear today from all of us that are speaking is really about these built relationships and networks and partnerships that we have through our offices that really allow us to do this work. And so we were able to really quickly get together a number of channels. So Ronnie Ram, who's our rural hospital coordinator, has a couple of hospital-based networks that she was able to get together via kind of Zoom and web chat. We have a Rural Council on Health that we were able to pull together. And we, because we sit in state government, we're able to help highlight issues out to our constituent partners about what was happening in our rural areas. And so it was a really quick and simple and effective way for us to use those communication channels to make an incident command list that was happening every day to flag to our supervisors and to move up the chain for there to be action to happen if there needed to be. And then there were items that we just were kind of watching as a baseline for the State Office of Rural Health and things that we thought might be an issue or things that we might need to coordinate. And it was a really nice way for us to just use a Word document, some good old telephone calls, and really just utilize the strength of the resources and networks that we had available and ready to us. We also utilized our email listserv to just reach out to folks and say that we were here, we were in our remote offices, and to plug in and to utilize us as a resource. And so I think this is just a really kind of no frills example of an easy way to pull together some environmental scanning in the COVID-19 pandemic. And so I think too, think about for you all, what kinds of ready networks do you already have and how do you communicate with them? What are your communication channels? Are you using certain types of software for listservs or for communication channels for folks to be able to chat back and forth? We'd love to hear about that. And if you want to share some of that, that would be great as well. And for me, this is my piece to now hand it over to the amazing Lisa Davis in Pennsylvania, who's going to talk to us kind of about a next step up on this continuum of work in the COVID-19 scanning. So I'm handing it to you, Lisa.
Anyway, Kirby, thanks a lot for the introduction. I'm not sure that I can actually live up to the hype of your lovely words before I came on the screen and no one could hear me. But I'm very happy to be here and very happy to talk about our environmental scanning process. When Chris pulled us together to talk about environmental scanning, I had a little bit of a panic attack because we do not have a formal written process that has been formalized in our office where we've all done training on how we do environmental scanning. So I had to give it a great deal of thought because, as I'm sure with all of you, we do a constant, continuous process of environmental scanning. We are constantly pinging out to the world outside of our office, into our communities, with our colleagues, with our state and federal partners, and then also wanting to sort of hope that they are pinging back to us, telling us what they need, what is happening, what's going on, where are their concerns, what is it that they need from us. So as I started to think about this, I came up with sort of this concentric zone here where, and I'm sure that this will ring true with all of you, we live in a world that is very much dominated by policy, by regulation, by our political environment, by forces that might be a little bit outside of our sphere of influence. But we then work in the sphere under that with the healthcare system and the providers. And we talk about their assets and their challenges, and we work with them to identify what those challenges are, what are the barriers that they have to being able to provide high quality healthcare services that's accessible to rural residents. And we think about that not only at the individual hospital level or at the individual community level, but we think about it across our state or across our region or across the country, trying to fit those individual pieces into the broader whole. We also are thinking about our communities. And as we all say, if you've seen one rural community, you've seen one rural community. And even here in Pennsylvania, when we think about our communities in the state, we have to remember that they are in different regions in our state. They are dealing with different issues. And so we try and pull all of that together as well. And then, of course, getting back to the why of what we were talking about during our keynote speaker is the why. Well, the why for us is to make sure that rural residents have access to high quality, accessible healthcare services that are affordable, and that they have everything that they need to achieve the best health status possible. So that is really our why and where all of this fits in. And just like with all of you, our process of gathering information is informed by everything that we do. Our national, state, and local partners, talking to healthcare providers, reading through the literature, hearing things coming in on the media, the data that we collect, the information that comes into our office or that we can access through, say, for instance, the MBQuip data. So anywhere that we can access data and pull that together, that's really helpful for us. And, you know, we're fortunate. We're at a research university. And so we are in an academic department and we get data from that academic department. And then we have our own strategic plan. We just published at the end of last year, we published our next 3-year strategic plan. And we also reference that into the work that we are doing. We look at the state and federal strategic plans. I actually have here sitting on my desk to my right, the HHS strategic plan that I want to make sure that we are referencing that we are referencing the CMS rural plan, anything else that we can access so that we know where the work that we are doing fits within the overall context. Some of you may have remembered that years ago, there was a fundamentals of rural health that was developed. And we have looked at that as well to see what are the core missions, aside from our mandates that we have from the Federal Office of Rural Health Policy, what are the mandates that we feel we need to be achieving and meeting here in Pennsylvania. And then anything else we can access. It never surprises me when I find information in the most unlikely of places. And when I had actually written this slide, I had something specific in mind, which of course totally escapes me at this moment. Our limitations are really our resources. You know, how much staff time do we have? What kind of funding do we have? How are we able to pull all of these data together? You know, I look at the Wisconsin Office of Rural Health and all of the work that Penny does. I wish we had those sorts of resources, and we really don't at this point, but it is something that we can aspire to. And then there, of course, always a bunch of surprises. So again, it's a constant and continuous process. And I called it the cycle of learning and discovery. So for the staff from our office who are watching this, they actually have not seen these slides. And so they may be thinking, they might be laughing to themselves. But I think that for all of us, we are constantly thinking about healthcare, rural health. I know in my house, when anybody like my poor husband wants to talk about something else besides rural health, I say, yeah, okay, but let's talk about me now. Because for me, thinking about rural health and health policy and the healthcare delivery systems is the most important part of my day outside of my family. And what we do with all of that is we bring that in and we integrate that into the technical assistance that we provide, into the information that we send out, into documents that we develop, into the input that we provide at the national, state, and local levels, into continuing education programs that we put together, and essentially anything else. What I hope happens in my head, which doesn't always happen, is that I start out with a pretty dimly lit bulb, which all of you may say it just stays that way. What I hope will happen is that it will actually spark, that I will be able to put pieces together to come up with a new whole. And so the next thing that we're going to talk about, Chris had asked us to focus a little bit on what we've done around COVID. And we took information in anywhere that we could get it. So all of the information that came out from HRSA and the federal office, I am sure that all of you spent hours and hours and hours in March, April, and into May reading, listening. It seemed as if about every 40 seconds there was a new piece of information that was coming out, and much of it was contradictory. So we started paying attention to what was happening with CMS, as did all of you. We actually set up biweekly calls with our regional CMS office. That's been a great benefit to us, and we have kept that up because that's been a good way for us to get information and to clarify information that's come out from CMS. We've watched the announcements from HHS. We paid attention to all of that information that came out through the NRHA grassroots advocacy forums. There was so much good information there. We also participated in the NOSORH listening sessions. So kudos to you, Chris, for pulling those together. They were very, very helpful. We spent time talking with our state partners. We spent time talking with our collaborators here at Penn State and also across the state. And then we started, looking at the websites, making sure that we were pulling everything together. We created our own website. So there was an awful lot that we were pulling in. And I'm sure, like all of you, it was like drinking from a fire hose. And I was grateful. We were all grateful for all the information, wishing every once in a while it would slow down just for about 40 seconds. But what we then did was we recognized, and actually I give a lot of credit for this to Jen Edwards, who's our Rural Health Systems Manager and Deputy Director. She really understood that the hospitals were responding to so much. And so she took the responsibility to pull together all of that information and to create a wonderful, cogent, clear compilation of the daily emails, all of the information that came out in, and she sent that out to all the critical access hospitals in the state. And Kelly Braun, who works with our rural health clinics, did the same thing. She sent out regular communications. They were at least weekly, if not more frequent. We also started to develop some technical assistance that we could provide to our partners, to the hospitals, to the critical access hospitals, the rural health clinics. And we realized one thing was that our hospitals and our clinics were pretty quiet. They did not have a lot of patients coming in, or they were closed. So we thought this was an excellent opportunity to use their time wisely, put together some coding and billing webinars. We did 2 webinars on the COVID SHIP funds so that we could make sure that not only did we understand, but that the hospitals understood how the COVID SHIP funds were to be used. And we then also realized that we had special populations here in the state, especially the Anabaptist community, which are the Amish and Mennonite, and other members of our agricultural community who needed some very clear, concise, consistent information. So we put together a number of documents and mailings and articles for newsletters and so on, and newspapers, because the Anabaptists rely heavily on newspapers. So that was one way in which we felt like we could provide some significant value out to our community. And I think that is our contact information right there. And now I am going to turn things over to Sarah from Oregon. When we came together and we were talking about all of the work that we have done across our 3 states, Sarah has such a wonderful process in place. So we're going to turn things over to Sarah, and she's going to tell us what they've been doing in Oregon. Thanks, Sarah.
Thank you, Lisa. I appreciate it. And I can take credit for these processes completely. Those processes have been put into motion for many years by previous and current staff. So I'd like to give kudos to them for that. So when putting together this presentation, I started to think about our processes in terms of a funnel, if you will, which I had to turn on its side because I didn't have enough room to fit everything in the funnel if it were the other way around. But all of these different pieces, all of these different bubbles, if you will, in the funnel contribute to our outcome, which is having a contemporary understanding of the needs in our rural health facilities and communities in the state. So much like what Lisa and Kirby discussed, I'll start with the partner and peer input, those relationships that you have with people and organizations across the state. So from the national perspective, we employ many of the same strategies that Lisa discussed. Paying attention to the NRHA listserv, paying attention to the emails that come out from our KITA, et cetera. And then also, as Lisa mentioned, the NOSORH listening sessions specific to COVID, we have found particularly helpful so that we can learn about the challenges and questions that other state offices of rural health have had and have addressed. And in non-COVID times and concurrent with COVID, we also are active in the NOSORH committees. The primary care committee, the policy committee. We find these committees as really good places to home in on where the issues that folks are talking about and to learn from other states about what they're doing. From the state level, we have a really good relationship with our state's hospital association. They have a regular CEO, rural hospital CEO call, and that's been in place for several years now. And so we listen in to those regularly to hear about the challenges that rural hospitals are facing, combined with our own work with the hospitals. But in that setting, it's a really good venue for us to hear from them. And then during COVID, the Hospital Association put together weekly calls where we were hearing about hospital concerns around PPP loans, state grants, PPE shortages and strategies and those sorts of things. So it gives us an idea of where we can partner with the Hospital Association to fill in the gaps that the hospitals have and that the Hospital Association isn't serving. We, we also are involved with our state's public health agency, the Oregon Health Authority. They have several committees which are tasked with defining Oregon's healthcare needs and developing the state health improvement plan, of course. And they derive those plans from subcommittees that we make sure that we're at the table at, so that we can make sure that the rural perspective is represented in the outcome of the plans. Furthermore, we stay in touch with and monitor and engage with statewide and regional associations and committees. So for example, to keep up with what's going on in Medicaid in our state, we're involved with our coordinated care organizations. We hired a rural health clinic program manager this year who has done a really good job of building a relationship with our state surveyor, so that she knows when RHCs are coming up for their survey and can help prepare them for a successful survey ahead of time. And then, there are other groups, regional groups that come to mind that cover subsets of Oregon and in some cases are adjacent states like Idaho and Washington, so that we can scan the activities that those organizations are doing within a more regionalized local approach. The next bubble is data analysis. And this is, I think what I'll talk about here is our Areas of Unmet Healthcare Needs report, which is published annually and has been done so for several years. We derive data from state licensing boards, from census data, et cetera, and it pulls together 9 variables that negatively impact a specific service area, zip code area, if you will, with items such as the total providers per population in primary care, mental health, and dental health, as well as people who fall into the category of being unable to afford health insurance but don't qualify for Medicaid. So the report provides a total unmet need score for each primary care service area in Oregon to illustrate the areas of greatest need in the state. So if a score is low, you can identify by looking at the report which of the 9 variables contribute to that low score. So for example, are community members unable to access mental health care because there isn't a mental health care provider in their area? Or is a significant percentage of the population between 138 and 200% of the federal poverty level, and then can't afford health insurance but also can't receive Medicaid benefits? So we utilize that data, and we have that at the ready within our office, but then also share that with folks through the report on our website every year. Next, I'll talk about the story map bubble. This is where we get, along with the data, a little bit more sophisticated in our approach. So our program manager, Rose Locklear, has developed a really great strategy around doing some mapping through story maps on our website. We have 3 currently. One is a snapshot of telehealth in the state of Oregon among Oregon CAUSE, which shows what type of telehealth services they provide, and also who their partnering distance site institutions are. And we also have a community health needs assessment, community health improvement plan, story map that is really a living repository of each hospital's CHA chip, with an effort to reduce the duplication of these resources and to support collaboration to address community health needs in a more coordinated way. I'll talk about this in a moment, but Rose also did a subset of her or actually it was a new story map, which outlines what telehealth looks like amid the public health emergency. We do the simple, the less structured piece as well. We're in regular contact with our RHCs, with our CAUSE, and with our EMS agencies via phone and emails, which are really temperature checks. So as you probably heard in the news, Oregon recently went through some pretty bad wildfires, and our RHC program manager emailed each of the RHCs in the state that had the potential to be affected by those wildfires to ask how they were doing. Were they evacuated? how are they handling patient visits? And in one case, one of our RHCs did burn down, and we're working with our state legislators and FEMA to make sure they're getting the appropriate guidance on how to serve patients in the interim, and how to get the conversation started on rebuilding. We do surveys. I listed Qualtrics. That's our platform. We've also used SurveyMonkey in the past. So that's a little bit more of a formal temperature check or assessment tool. And we typically use that to measure how well we're doing on a learning objective with a particular programming initiative, or to measure, we put out a survey before we go into the development of a work plan to make sure that we're capturing all of the needs of our CAUS, RHCs, and EMS agencies as we're doing our strategic planning for a given time period. And then the listening tour. This is probably our most intensive, but arguably our most important environmental scan. And if you go to the next slide, Kirby, I will talk about that a little bit more. So several years ago, the concept of a listening tour in our state that included rural agencies, kind of a mixture of agencies at the time, RHCs, CAUS, et cetera, was started with the goal of bringing healthcare stakeholders to rural and frontier facilities to discuss challenges and to encourage partner collaboration to address solutions. So we do this by gathering a list of statewide stakeholders from the groups we focus on. So this year was supposed to be the rural health clinics. And we gathered a list of people that they had to choose from to bring out to their facility to hear their challenges and their needs. So stakeholders include organizations like coordinated care organizations, local public health agencies, workforce groups like community colleges for allied health workforce challenges, or our nursing association to discuss nursing workforce challenges. And then also state legislators to discuss policy. And then each of those RHCs, as I mentioned, is invited to have a listening session with their selected stakeholder. And the important part here is that we're not coming to the table with the agenda. The RHCs are, or, in this case, what was supposed to have been this year, the RHCs were coming with the agenda for what they wanted people to hear. So it's a really good way to focus the conversation on the specific needs of the clinics or the hospitals or EMS agencies, whichever group that you're focused on, with a listening tour. So our staff coordinates the logistics of each meeting, travels out to each of the sites to moderate them, and then take notes, and that results in a report that we publish on our website as well. I'm going to skip ahead a little bit because I have a timer and I just ran out of my own time. So I'm going to move on to COVID. In light of having to cancel our listening tour this year due to COVID, because the listening sessions, we felt being in person was really important. And we also talked with our clinics, and they didn't want to necessarily have virtual sessions. We really had to quickly pivot our strategy. We have a listening tour, but we also have this pandemic going on. How can we support all Oregon facilities, rural facilities, and address their needs? So we started with studying the emerging state and federal guidelines, including the 1135 waivers, telehealth rules, public health emergency temporary rules, CARES Act funding. And we really quickly then developed a web page focused on COVID for our state rural agencies. And looking back on my notes and emails, we launched that page on March 19th of 2020. there was just so much information, a flurry of information coming through, that we felt that it was important to organize the information in a way that was specific to the different groups. So we had an RHC or still have an RHC section, a CA section, EMS section, a community section, so that people can quickly see and find the information that pertains to them specifically. We also, as I mentioned a little bit earlier, developed a public health emergency telehealth story map that outlines the temporary rules that were put into place amid the public health emergency. We attended our State Hospital Association rural CEO calls to monitor how the hospitals were doing. And we dialed into the NOSORH COVID listening sessions to monitor what other state offices of rural health were hearing and doing. And then we also, with a special focus on the RHCs, launched a bi-weekly RHC listening session. So that's one group in our state that doesn't have a regular call group or peer group formed already. And so we really found that as a need. And we hired our RHC program manager at the 1 year ago, almost exactly. And she was tasked with supporting the RHCs, but also building that community. And we were doing that pretty organically, but really had to hone in on that as a result of COVID. So we started the rural listening, the rural health clinic listening sessions. And during those sessions, we found that, the RHCs were really confused about how to communicate to the patients. What's all this CARES Act funding? So we were able to gather information about the questions that the RHCs had so that we could go back and then develop communication and education around those pieces. And of course, all of this was done simultaneous to email and technical assistance check-ins with our RHC program manager as well. Next slide, Kirby. It talks about some of the outcomes that I described along the way, but just to review, through our environmental scan, we really grew to understand the needs of the RHCs, the cause, and the EMS challenges due to COVID. We developed the COVID-19 dedicated webpage, and we really accelerated the rate at which we're able to build a community among our rural health clinics. And then lastly, I just want to talk about, next slide, please, Kirby. Looking back and looking forward at the same time, COVID has really created some opportunities for us, and being on the ground with our monitoring strategy, our environmental scan strategy, and the communications that we were doing with our state and local partners and our rural agencies, it opened up some new growth areas for us. In fact, we have a potential contract with the state of Oregon to address increasing testing in rural areas, and a potential contract with our state's telehealth association to expand our story map to include more facilities related to telehealth. And then it's also provided the seed for us to bring our RHCs together in a more coordinated manner, and to discuss more, going forward, more general challenges and best practices among that group. So at this point, I am going to turn it over to Chris, who is going to take us through an exercise in sharing best practices.
Great. So, can we get that last page of the slide back up there real quick? Okay, great, wonderful. So, as Kirby had said earlier, right? Think about these questions that are here on the screen, right? How are you collecting data and information? How do you look at and analyze that information that after you bring it in? How are you sharing that information out? Who are you sharing it with? And lastly, what are your your tips and tools, right? We've had a couple people, 2 so far, that have offered up some information in the chat box throughout the session. So right now, what would be really great to have the opportunity to hear more about what it is that you guys have done at a state level. And we're going to share this document here, which really is just broken down into the 5 buckets. And as you guys share those examples, we will add them in here. And just for your reference there at the top are those questions again. So the 2 examples so far that we had come in, the first was there from Arizona about holding COVID office hours. And it really helped the hospitals to stay open safely. And it included data, PPE, but even also the change of the flow of their floor plan, right? So that they were able to keep those patients safe. Maine also shared that they were doing weekly meetings with their safety net dental clinics. That's something pretty unique. And that those clinics were providing emergency dental care in rural Maine. So any other examples? And while we wait for those to come in, Sarah, Lisa, and Kirby, is there anything additional that you might want to add there?
I'd love to hear about any tools that people are using. I think there's just so many things that are out there, and it almost feels a little bit overwhelming sometimes because there are so many different tools. We use our good old straight up email and phones and like being in community, but I think tools have been really helpful, especially with the COVID-19 pandemic, and kind of helping us pivot a little bit in the way that we do our work. So I'd love to hear if folks are using different tools out there, and also how people are analyzing and looking at the information. I think there's a lot of different ways. I see some really cool dashboards and maps and things that some of the offices are putting out. How are you putting that stuff out? What are you doing? What are you using? What kind of resources does it take to do that? Those are some of the things that I really think about. I mean, TrueServe for us allows us to look and analyze some things, but what other places are people doing stuff?
So, hey, Chris, this is Lisa. In thinking of, in hearing the presentation from Kirby and Sarah, and also seeing what's come up on the screen here and all of the information that was discussed during the COVID listening sessions, I'm wondering if this isn't a great cache of information to share with the federal office and to try and categorize this with, I think, whenever we go into TrueServe, we're supposed to be identifying what are best practices. I think that our collective effort across the country is a best practice. And I think that there are lots of ways in which our Venn diagrams of the work that we've done overlap. And I wonder if the federal office could use that. That might be a great talking point with the Secretary of Health and with others. So not to add more work for NOSORH, but this might be a really great data collection process.
Thanks, guys. So I'm looking at the chat here, and we've had some more examples come in here. Kirby, community surveys are being done in Massachusetts. Kathleen says. So what online tools can you recall are being used there?
Yeah, so we're in the process right now of surveying the entire state on a community impact survey. And that is literally being done with a Qualtrics survey that's going out across the state. But it's specifically looking to look at a zip code level to identify inequities in certain populations, specifically rural populations, people of color, folks who identify as LGBTQ, so that we're really able to start to hone in on the disproportionate impacts that COVID have had on social determinants of health and some of those impacts. And we're really excited because the way that they're putting this survey together means we're actually probably going to get some rural data that we can look at, which doesn't happen often in our state. So that's an exciting win for us here. So thanks for bringing that up, Kathleen, because that came onto the radar like after this presentation got made. So
thanks, Kirby.
Google Forms.
Yeah.
Sorry.
So no, you're good. Yeah. So South Carolina is using an app called QuickBase that allows them to track that. And then Hawaii mentioned Google Forms as useful for collecting data. So that's really good.
Simple tools. I love that.
Yeah. And you know, something that Colorado shared was right. In addition to that first piece they shared was that they were hosting a series of webinars for RHCs around telehealth implementation, focused on billing, integration with workflow, and vendor selection, those things. And it seems to be as a result of that environmental scanning, we saw this need, right? We're going to take some action here. So that's wonderful that Colorado's using it that way. Also going to get the one from Vermont on here.
You know, and I hope that folks today really have just taken away, because one of the things that prompted the session was that environmental scanning was like one of the skills that people felt like they needed improvement with. And I hope that this session, if anything, has really shown you that you're probably doing a lot of really great environmental scanning in your office already. It's just sometimes hard for us to identify that that's environmental scanning because it's what we do every day in our jobs to just be on the ground, in tune and effective. And so if you took away nothing from today, just take away that you're probably doing a great job and you have things to share that we want to hear about.
Kirby, I'm glad that you made that point because when I was thinking about the presentation, I wasn't thinking about, a formal process that we had written down, but realized that it was the culmination of a lot of different activities that started at a lot of different times. Some are more recent and some have been used since we started. It's something that I think that can evolve organically, and you can implement new tools as you get new resources, perhaps as well.
I see a second QuickBase user.
Yeah,
that's fantastic. I'd love to check that out. We'll have to look at that in the educational strategies group to see what that is, and maybe there should be some future learning about that. I think that sounds fantastic.
Chris, this document that you're pulling together right now, where will we be able to access that?
Yeah, so the game plan is that we will take this back to the Educational Strategy Committee. We'll take a look at this. We'll make it into some just basic information that you guys can, and with clickable links, something usable, a quick reference guide you can keep as a second resource, right, to those core proficiencies linked into that benchmarking report. So we'll make sure that is available to everybody as soon as we finish, kind of polishing this up.
Sounds great. Thank you.
And also, is there an opportunity for folks to share things after the session to you, Chris, to be included on here?
Absolutely. If you have other things that you didn't have an opportunity to share during this session or think about something later, feel free to email that over to me at any point. We'd love to get that in. I believe we don't have another Educational Strategy Committee meeting until early November. So that should give plenty of time for people, right, to get things over to us.
Yeah, because I know that for me, sometimes it's like a lot of work to type like a long thing into a chat box and hit enter and have to enter it 3 times. And so if folks want to share via email as well around some of this stuff, I just think it's helpful to hear about the different processes that people are using, the way that they're collecting stuff and the way that they're putting it out, because I'm always thinking about in my work, how can I be more efficient in what I'm doing, how I'm tapping into folks. And the other thing too that I think is interesting and maybe folks would be willing to share is, how are you gut checking that you aren't missing people and missing swaths of your rural constituents or populations that may be unseen and unheard in the spaces that we typically connect with. And that's something that I think we're all challenged with. And if folks have come up with some strategies around that, what are you using to think about reaching those populations that maybe we don't see and hear from all the time? And I think that's a great example too for you, Lisa, and the work that you all have done, with the certain communities in your state, specifically with the Amish and the Mennonite communities and some of those other pieces, because those are communities that it takes relationship building and trust and all kinds of different things, and understanding how to navigate that. And so I think kudos to you all in your office for doing that, but thinking about how this all flows together in other populations that we're serving in our states, and how do we hear from them?
Great points. Yeah. Well, we just have a couple minutes left. I want to give you guys the opportunity, if you have any closing thoughts, parting wisdom that you'd like to share with anybody. And just to let people know, keep putting that in the chat. We'll be able to see this, so I'll continue to pull from the chat box even after this session is over. But leaving the floor up to you guys if there's any parting words you'd like.
Well, I'll go first as someone who can't keep their mouth shut. And that is, I think that one of the things that I always think about is that everyone who works in the state offices is so smart. And every day I learn more from all of you than I might ever give back. So, while we might be doing one thing over another, I think that the collective activities across the state offices are absolutely vital to the rural communities that we're working in. So we might have one strategy, but that doesn't mean that it isn't as robust as what someone else is doing. And all of us together, I think, are quite complementary and quite impressive.
Thanks, Lisa.
Absolutely, Lisa. I would totally just piggyback on that and saying that the vision we had for this session was really to collect all of the amazing information that you all have to share, because this meeting every year for me is about connecting and learning about all the great work that people are doing in all their states. And so please continue to share, continue to connect, and we look forward to putting together a great document and resource to share back out with everybody else.
Yeah, I think Lisa and Kirby said it all. I echo their comments and do look forward to hearing from all of you and learning from you as well.
Well, I would just like to say thank you to all three of you for sharing your expertise. And really, Lisa, as you alluded to, right, you don't think about how you do this and do this well. Partially because it's just part of the fabric of being a state office, right? And so sometimes it's just putting, as we say at NOSORH, some curbs around that, right? So that we understand that there's a formalized process and approach to doing that. So thank you guys so much for sharing all the wonderful examples. And to Lisa, Sarah, and Kirby, thank you guys so much for sharing your expertise with us today.
Thank you.
Thanks. It was a lot of fun.
Yeah.
We had a great time putting it together.
We did.
I think we did. We had more fun doing the tour.
Right, exactly.